we are going to talk a little bit about sutures. So I believe a lot of externship students have trouble with sutures. So on this video, we're going to talk a little bit about sutures the way I understand it. And obviously there's a lot to it, but I like to say there's simplistic aspect to sutures. And I'm going to break it down and probably put some pictures up during the process. Maybe have some questions a little bit about sutures, but CST exam involves sutures. Out in the real world, we need to know at least basics of understanding sutures so we can have it ready for the doctors, right? So that's what we're going to talk about on this video. Again, don't forget to like and subscribe. It helps me out, get the rhythm out there. I just want to say thank you a little bit about trying to watch these videos, because it does get the information out to other students and help to grow this YouTube page, because I'm all about trying to get information out there for students. But let's talk about sutures and just roll right into that, right? To me, sutures, if you start thinking about the simplistic of it, sutures have two categories. You think about absorbable and non-absorbable, and they are used in many different aspects. They're kind of self-explanatory. One is going to absorb and one is not, right? So think about it. If we're going to sew something up, we have two kind of parameters to it. We want it to stay there maybe short term and then disappear. And also we want another scenario, maybe we want something to be strong and stay there for long periods of time. For example, if you're suturing up the omentum or mesentery, we probably want that to stay there temporarily and then absorb into the body. Maybe on the other spectrum, and maybe we want something to stay there long term, maybe like a tendon or something tough. Orthopedics comes to mind. We want stuff to stay there long term, or maybe vascular, right, for vessels. We don't want things to disappear and start to leak on us or fall apart. So think in that aspect. Sutures, right? Absorbable, non-absorbable. There's something called multifilament or monofilament. You know, multifilament's also called braided type of sutures. Again, tensile strength, right? That really means about how strong the suture is going to hold, right? So orthopedics, you want to have good tensile strength, right? You don't want it to break and fall apart. But also on the opposite spectrum of that, we don't want sutures to stay there long term, right? So anytime you put something in the body, it's going to absorb. It's going to have an inflammation property to it, right? It's going to cause a reaction to the body. So let me just break it down for you, and hopefully I'm going to be putting some pictures up, kind of show what I'm trying to talk about. Absorbable sutures, will start there. So general characteristics, right? These sutures are designed to be broken down and absorbed by the body over time. Obvious, right? So types, and these are just some examples, right? Monocryl, and I'll put a picture up on what it looks like, and there's different colors of these. What would you think monocryl is used for? And if you're in the field, you know it's probably for closure. It is for closure, right? It's a monofilament suture, which means it's one strand of suture. It's used for skin, cosmetic surgery, soft tissue, right? Available in undyed, clear, or violet. I typically use these like close and trocars, very simplistic type of closures. Definitely the top layer, subcutaneous, or the top layer. It typically is what you would use those for. So monocryl, you can see it up on the screen. It's definitely a certain type of color, right? Another type of suture that's absorbable, right? Probably the most common, in my opinion, is vicryl, and I'll pull that up on the screen also. It's also called, what confuses people, it's polyglatin 910. That's just what it's made from. You know, who knows about that term, right? But it's a multifilament, which means it's braided, a little bit stronger, right? Commonly used in subcutaneous layers, closures, soft tissue, and obviously available purple or white, and based on what hospital you're in, but probably a purplish color, right? And so you can identify these sutures by color, definitely. That's most people do. But vicryl, I mean, I can go on and on, but typically small bowel comes to mind, 3.0 with a pop-off, they call them, or a quick release used in a lot of perforated bowel surgery, right? Bike rolls. Chromic, I'll put that up on the screen. It's a monofilament. It's a one strand, right? Indicated in OB, GYN, facial, oral surgeries, obviously. The mucosal layers, right, of the intestines. Sometimes they will use chromic. And what is chromic made from, right? That is derived from, you guys know? Is it the sheep or the cow? Yeah, it's a bovine. It's from the intestines of a cow, right? Plain gut is probably from sheep, but these are old-time sutures, probably where it started from. In my opinion, used in mesentery closure, maybe in circumcisions. You want it to be there temporarily and just disappear, right? No one wants to go back into a circumcision and take out sutures, right? So chromic is an absorbable type of suture. PDSs, and I'll pull that up, right? That is a monofilament suture, right? Soft tissue approximation. There's a Maxon or a PDS. Those are for large belly closures. PDSs last a long time, right? They're absorbable sutures, but they last. They're strong, probably of the absorbable ones. I guess it comes in a black type of container, or a package. I'll put it up on the screen so you guys can see that, but that's a monofilament type of suture. Again, all these sutures, put in the comments, where do you guys use it in what scenario? Because as you know, doctors have variables, and I think it's hard for students to understand, you know, what suture we need at one time. But if you can kind of use a simplistic thought pattern to it, helps me, you know, at least understand in that aspect. So let's jump over to non-absorbable. So obviously the characteristics of that, self-explanatory, right? They're designed to remain in the body permanently, right? We want something that'll stay there and not go away, hold the structure as it heals. So nylon, right? We've all heard of nylon. I'll pull the picture up and I'll stop saying that because I'm probably putting it up every time. But primarily used in skin closure, something called interrupted sutures. All that really means is they're spacing out the closure, the approximation, right? I use nylon sometime in closing or holding drains in place, right? So black, green, clear, but typically I would say that is a green. That's a synthetic type of suture, right? So nylon, very flexible, just like it kind of sounds. It's nylon, it has a good give to it, just like silk. But that is a monofilament, non-absorbable suture, right? So Proline. For CST purposes, you should know that is the most common for vascular. So I'll put that on the screen one more time. Monofilament also. This is a non-absorbable area. So Proline. So Proline is used in vascular anastomosis, right? Grafts. They're typically blue in color. Something called double arm sutures. So I have two of them on there. And obviously those are countable items, so make sure we're counting both sides, right? Why are they double armed? What is your research? My research is it's for anastomosis, to get a circumference around something, right? You can close on one side, suture around the other, and then tie it off, right? Proline, probably the most common per the AST or CST questions. Most common suture used in vascular anastomosis. Another non-absorbable is silk. That is a multifilament. So nylon and silk, very similar. The only difference here is nylons are monofilaments and silks are multifilament, a little bit stronger. So yeah, they use it for surgical drains, holding the drain in place. They kind of have good flexibility to it. So they can be used to tie off vessels on occasion. You know, just be careful that they don't use it when there's infection, because they have something called a Wiccan action where they absorb some of the infection, cause more issues. So, but silk, in my opinion, an old suture, but used strong, has good durability, has good flexibility, tying off drains, can tie off vessels for like ligatures too. Another non-absorbable steel sutures, I think maybe fiber wire comes to mind. That is a monofilament, maybe for sternal closures for cabbages. Yeah, I have a lot of CST questions. What is the one that is used in infection? Steel comes to mind, but it should be for infection a monofilament type of suture, right? So that's a CST question, right? So what type of suture would you use for an infection? Monofilament or multifilament? We should use monofilament. Reason is because it's one strand. It's not going to be traumatic as it slides through whatever it's closing and cause more traumatic or infection that way. So a monofilament is used, or a steel is a monofilament. Steel is used for cabbages, right? So that's just an example of some sutures. There's probably other ones out there, but I just touch on a couple of them. And I'll probably get a kind of follow-up video on sutures. But here's another thing, common used for non-absorbable. Here's some examples. A 4-0 nylon, what would you use that for? Me, interrupted sutures, skin closures is typically what I would use it for. Orthopedics, a lot of you use it for the top layer, interrupted. But for me, a 4-0 nylon is a interrupted skin closure suture. How about a 2-0 silk? Yeah. Secure and drains is probably what I would use that for. 6-0 prolines, right? Repair stitches of blood vessels. Like I said, most commonly used in peripheral vascular or vascular in general, right? How about a 5-0, 6-0 proline, right? I would say it's also used in AAAs, fempops, carotid arteries. I know there's other sutures out there, Gore-Tex and other sutures can use, but we're just going to base our opinion on AST questions or CST questions and the most common, right? All right, close-in standards. These are some sutures used for closure, in my opinion, right? Monocryl, like I alluded to before, a monocryl 4-0 PS2. And I'll get to these classifications on the end, like PS2. What do they stand for? CT, SH, PS, UR, all these codes. A lot of people don't understand. They do have, kind of will lead you towards what the suture is used for, right? So PS, plastic surgery. 2 is probably just the size. So a monocryl 4-0 PS is probably used in skin closure, and I would say that's also a cutting needle, right? And I'll go over needle tips in a minute. How about subcutaneous? It's kind of lower down, right, from the dermis, you know, dermis or the epidermis, the dermis into the subcutaneous. You probably want to have vicryl, maybe in the borderline of the fascia there. So a vicryl is typically what I would use. A 2-0, 3-0 SH. Now, what's the SH stand for? Circle half. That really is referring to the needle. You know, this PS, SH, CTX, these are all needle sizes, where the sizes like 2-0 is referring to the actual suture size, right? So subcutaneous, vicryl 2-0, 3-0 SH, probably the most common. Now the fascia, a little bit lower down in there, probably a PDS, number 1, 0. CTX just really means an extra large of the CTs. Probably, in my opinion, used a lot of the time as a PDX. Now, there are some other ones out there, Maxon, but I'm just giving you some most common ones in my life. Now, if you don't know suture sizes, and you probably do, but I'll refresh your memory, they range in size between 10-0 to 2. Now, do you know which one is bigger or smaller? You would think the 10-0 is the largest of the one, but no. They have a -0 on the end of a couple of these. They really signify getting smaller and smaller and smaller as they go down to 12-0, which you can use in microsurgeries, right? When you get to 0 and you move up, 1, 2, 3, and so forth, they get larger, that aspect. So just looking at surgeries in eye surgery, what sizes would you think you use in surgeries for eyes? Yeah, 10-0, 9-0, 8-0, those are small sutures. I can barely see those, right? How about repairing of small vessels or arteries, right? Facial plastic surgery, right? 7-0, 6-0, right? And you can kind of see how this goes. Large vessel repair, 6-0, 5-0, just like the vascular sutures. Skin closure, right? 3-0, 2-0. Fascia closure, 0-1. Repair of tendons, probably 2. Now, these are just some examples of sizes, and as you're out there, you probably know that. And more likely, when you get more experience, you kind of realize those sizes within those categories, right? Now, let me just talk about needle tips, right? We had talked about needles and threads, but tapered. Keep these in mind. 3 areas: tapered, right? Blunt, or cutted needle. And we'll put the blunt needle off to the side for a minute. We'll just talk about tapered needles, right? They're for delicate tissue, and I'm talking about the edge of the needle tip itself, right? So we want to make sure it's not sharp and tearing tissue. It's a little bit kind of rounded a little bit, but it can push through, not cut through, right? Used for probably internal closure and delicate tissues. Probably like the colon comes to mind, or small bowel. What about cutting needles? Yeah, just like it sounds, right? It's going to cut through tissue. There's conventional cutting, there's reverse cutting. I'm not going to go over all that right now, but yeah, used for skin, tough closure, so they can penetrate through there, right? You never want to close the top. Just do it once if you ever want to close, if you're a first assist with a non-cutting needle. I mean, it really is trying to push through things. So skin closure. And let's talk about codes. And you can go on, but let's talk about CTX, right? That is really a CT is a circle, tapered. X on there means it's larger in size. You can have a CTX1, CTX2, CTX3. They just get bigger and bigger in sizes, right? Fascia typically are using these CTX. So when you think CTX, you're thinking of fascia or abdominal closure, in my opinion. Now CT1's circle tapered. It's a circle needle and it's tapered on the end. We talked about a little bit of taper, goes through delicate tissue, right? So maybe closing up joint spaces, right? Capsules. Maybe some deep tissue fascia closure, also general surgery. And some of these things can fit in multiple areas, but in my opinion, I use them a lot of the time in closing up the knees, CT, maybe like vicral typically, right? How about CT2, right? We got a little bit bigger inside, maybe used on the uterus in OB/GYN cases. How about SH, circle half, right? Used in probably bowel surgery. So 3/0 vicral pop off definitely is an SH in my opinion. How about CVBV? You know, they talk blood vessels. That stands for blood vessels, and so BV is blood vessels, right? Used for vessels, obviously, in nerve repair, and probably with a castral VAO needle holder, right? So those are some tapered examples. How about some general uses of cutting needles? Something called PS2 or FS2, or commonly for skin closure on occasion. Maybe for like plastic surgeons, they use a lot of PSs. That's what it stands for, plastic surgery. You know, facial surgery. Common sutures used when you have those codes. PS3 is just an extra larger of those needles. PS2, PS3, they can be used in a lot of plastic surgeries for skin closures, but I find that more for plastic surgery scenarios. Let me give you a question, see if you know the answer. If I was coming into, and I had a kid coming into the ER and they have a laceration on the face, would you use an absorbable suture so you can suture up that laceration and you don't have to bring your kid back to the OR? And just keep in mind, this is a plastic surgeon's perspective. Or would you want to use a non-absorbable, like a nylon, interrupt it and come back later to the OR and take off the stitches? Now you ask yourself, I don't want to bring my kid back, but in a plastic surgeon's perspective, an absorbable is going to have more skin reaction, more inflammation, thus more scarring. And they're all about skin closure and making sure there's no scars. So most likely you want to have, most plastic surgeons will probably put in a non-absorbable nylon, typically they would use, right? So yeah, plastic surgeons. How about UR6? UR stands for urology, right? Used in a lot of urology cases. I find that they use it in scenarios when they put in something called a Hassan trocar. And if you don't know what that is, it's a cut down where they're putting a trocar in and they'll stitch on the sides of the trocar to hold it in place. And it's also used to close the inner fascia at the very end, right? So UR6, because the UR6 has a kind of a U shape to it, right? So they can get a good curvature around the suture into that fascia. So Anyway, some key takeaways. Hopefully I put some pictures up during this process. There's a lot to it. You should know the difference between absorbable, non-absorbable, multifilament, and monofilament, right? Just gave you some good examples. Well, hopefully this helped. Give me your comments. What is your example about sutures? Is any of this right? Anyways, don't forget to like and subscribe, watch these other videos, and hopefully I can give a follow-up on sutures. Thanks for watching. Take care.